All right. Good morning or good afternoon. This is Megan Renner with the USBC, and welcome to the 38th Bi-Monthly Breastfeeding Coalitions webinar. We are going to start off with just a little bit of a background and introduction before we get started. I am moderating the call today, and this is a series of bi-monthly webinars that is co-hosted by the USBC and the CDC Division of Nutrition, Physical Activity, and Obesity. The webinars are held every 2 months on even-numbered months, the second Tuesday at 2 o'clock Eastern Time, and they are bringing together state, territorial, and tribal coalitions to share best practices and network on issues of national significance for breastfeeding. Just a quick reminder about the change that we made. This is the second month of the second session of the change in access to national webinars. The access is now open to all interested breastfeeding coalition members. There is no longer a limitation on attendees per state. The announcements are sent out through USBC's coalition's announcement list. They're also posted on our website page, the landing page for these webinars, so you can register through that website, or you can also join our coalition's list at this link, usbreastfeeding.org/signup. So do go ahead and join that list if this is your first time and you have not signed up before. Also, just a reminder, we do have regional networking calls immediately following the national webinar. Every state and territory has 5 lines to dial into those calls, and the tribal region has 20 lines. And your coalition-designated contributors manage the use of those lines. So if you are one of those folks dialing in after the call, we will tell you what to do at the appropriate time. Just another reminder that the details, as well as recordings and slides from all of the past sessions, are found on the website. You can either follow the link that came in your webinar confirmation. It will also come in a webinar follow-up email about an hour after this webinar ends. And then another way that you can get to that materials page at any time, if you go to our home page at usbreastfeeding.org, I'll show you a quick shot of what that looks like. On our home page down here on the right, you'll see the quick links box, and within that box there's a link for bi-monthly coalitions webinars. So that's the way to find that information at any time. Another reminder that during today's session, all attendees are in listen-only mode. We do have a question and answer period at the end of the session. And in preparation for that time, you can ask your questions at any time simply by typing them into the questions box on your control panel. I'm going to show you what that looks like here on the next slide. So if you are logged into the webinar on your computer, you'll have a control panel that looks like this. If it is by chance minimized into just this little section with the orange arrow, you can click on that orange arrow and that will pop it in and out into expanding and contracting it. But there will be a questions box where if the arrow is pointed to the right, just click it so that it points down and you'll have a spot that says type question here. So again, please feel free to type in questions for us at any point during the webinar. I'm just going to introduce our topic for today. Our session is entitled Solutions for Supporting Breastfeeding Moms in Challenging Worksites, and we will focus today on some exciting new initiatives coming out of the Office on Women's Health in the Department of Health and Human Services that are targeting hourly workers and women who work in more challenging work sites for breastfeeding accommodations. We have 3 presenters for today's call. We will start off with Ursuline Singleton. She is from the Office on Women's Health and is the project officer for this project. She will be followed by Cathy Carothers from Every Mother Incorporated, and she is the project director. And lastly, we will also hear from Ryan Comfort from Cofective.com, and he is providing oversight for the website development that is going on with this project. So I'm just going to make one other note. I know we have lots of questions about this, that we do not have PowerPoint handouts or slides for today's session. We will be displaying some information and slides and websites from the project through the webinar screen, but we do not have handouts at this time because these materials are still going through clearance at HHS. So our presenters will tell you more. There will be lots of ways to get additional information about this, and we will, of course, have the audio recording. But again, there are not slides or handouts to print out for today. Again, we'll share the audio recording, and our presenters will tell you more about how you will get more information in the coming months. So without any further ado, I'm going to go ahead and turn it over first to Ursuline Singleton to talk about introducing the project and the session today. And Cathy, I have made you the presenter so we can see your screen.
Great.
So Ursuline, take it away.
All right. Hello, everybody. Thank you so much, Megan. I want to start with a slide that says the time is now. The time is right. Support for lactation at the federal level is one of the reasons that we can say this. We can say that the time is now. We can say that the time is right.
Welcome to GoToWebinar, Web Events Made Easy.
Been in the works and that are, currently, that we have in place currently. And I'm going to go over some of these with you. I'm not going to spend time with them, but I just want to start with, of course, the business case for breastfeeding, which was launched in 2008, 2009. We have the Affordable Care Act that went into law in March of 2010. The Surgeon General's call to action to support breastfeeding was launched in January of 2011. And Action 14 of that ensure that employers establish and maintain high-quality lactation support programs for their employees. The National Prevention Strategy, 6 months after the release of the Surgeon General's call to action to support breastfeeding, she also released the National Prevention Strategy in June of 2011. And the prevention strategy has an overarching goal of increasing the number of Americans who are healthy at every stage of life and envisions a prevention-oriented society. And we know that that begins with breastfeeding. Action step number 5 actually says support breastfeeding. Let's Move. We know that there's support for breastfeeding in the Let's Move campaign. And of course, Healthy People 2020 has now as an objective to increase the proportion of employers that have worksite lactation support programs. The 2020 target is 38%. I want to mention just some of the federal agencies that are partners and collaborators with us. Of course, MCHB, which is HRSA, the Maternal and Child Health Bureau, who developed, of course, the business case on breastfeeding. The U.S. Department of Labor is the lead federal agency on 4207. The Office of the Surgeon General. I want to mention the Office of Personnel Management. In December 2010, a presidential memorandum went out that there should be appropriate workplace accommodations for government employees who are nursing mothers consistent with the provisions of 4207. And so OPM, in collaboration with OWH, has sponsored business case for breastfeeding trainings. The most recent one was held on December 3rd. And some of the federal agencies that participated included the Department of Commerce, the Department of Defense, Department of Transportation, the Department of Justice, FEMA, there's been USDA. So many of the federal agencies have been trained through the business case for breastfeeding trainings that have been sponsored with the Office on Personnel Management. CDC is always a strong federal partner, and we interface with CDC on a regular and ongoing basis. And of course, the U.S. Department of Agriculture, the WIC program, WIC has been very vital to this project. Many, especially at the state level, where many of the activities have been partnered as a result of partnering with some of the WIC agencies. I want to give you just a very quick background on this project. I'm going to start with the purpose of this OWH project, and it is to help employers of hourly wage earners or those that are in challenging work environments comply with the provisions of the ACA, the Affordable Care Act, that requires employers to provide time and space for lactating mothers returning to work. Now, this project, this current project, builds upon a previous OWH National Outreach Initiative that was developed and implemented beginning in 2010 to improve worksite support for breastfeeding employees. This initiative involved outreach with national business organizations and labor unions to provide information, education, and resources on lactation worksite support. We wanted to learn about their concerns and their perceived barriers. So some of the businesses that we did outreach with included the Society for Human Resource Management, which is you hear it referred to as SHRM. There are over 250,000 members that are a part of SHRM. The American Businesswomen's Association, the U.S. Chamber of Commerce, AFL-CIO, the American Federation of Teachers, the National Retail Federation, the National Restaurant Association, just to name a few. And we actually did face-to-face outreach with them. And as I said, we wanted to know what their perceived barriers were, what their concerns were. In support of this outreach initiative, a national summit was held in the fall of 2011, and it included the federal agencies, the business organizations, and breastfeeding advocacy groups. We also conducted webinars as part of this initiative and provided representations at conferences, their annual meetings, and at major business events across the country. And as I said, the goal was to lay the groundwork that allowed us to address the concerns, at least be aware of the concerns that were identified by many of the businesses. This current initiative that we're going to talk about today, as I stated earlier, has a focus on challenging work environments. The information that we have gathered through this project, this initiative, will populate a national searchable solutions resource on the website, the OWH website, www.womenshealth.gov, primarily for businesses, and it will include photos, videos, and achievable solutions for accommodating nursing women in the workplace. I'm going to turn the program now over to Cathy, and she will provide additional detail about this exciting project.
Thanks so much, Ursuline, and welcome to all of you. I just want to say that this particular project has just been an amazing journey, and we have some wonderful partners who have been able to work hand in hand with us, and we're very excited. We're going to have the opportunity to roll out and show you some of the new resources that are soon going to be available to help you in your work with businesses in your community. I do want to mention that this project is a collaboration between Every Mother Incorporated and Altarum Institute. And so we'll talk a little bit more about the roles of each of our organizations. And then we have a number of major subcontractors, including Ryan Comfort and his group at Cofective.com. So he'll be telling a little bit more about the website portion of the project. One of the first things that we had to do as a part of this project was to find the businesses. We knew there were businesses out there already doing a lot of wonderful work. We heard a lot of wonderful anecdotal stories, but we just didn't have the firm data on who was doing what. So we began by selecting 10 state breastfeeding coalitions through an application process. We selected 5 in the eastern part of the country, 5 in the western part. And I will say that Altarum Institute has been providing the oversight for the project in the western half of the country, whereas Every Mother is providing oversight in the eastern part of the country. We asked these coalitions to identify at least a minimum of 10 businesses in their state, preferably of varied industry types that were already complying with the law and had creative solutions that could be shared and might be able to work in other businesses just like theirs. So we asked the coalitions to make site visits to these businesses and collect some very detailed information about their program, to take pictures, to gather quotes, and then everything was uploaded to an online submission site that Ryan and his team set up for us. Was a lot of very detailed information that we collected. Not all of it is going to be displayed in the first round of the website. However, there's some rich data that we've been able to collect that will be used for enhancements to the website in the months to come. I do want to point out that the project was and continues to be open to all coalitions. So we did receive submissions from coalitions all across the country, and because we have built the relationships with the business organizations, we also asked them to get information out to their members. So Ryan and his team actually set up a public side of this submission site, which enables anyone from the community to be able to submit what we like to call internally hot leads. And these are the leads of businesses that have a story that they would like to share. It's been an incredible process. We have collected now stories on 163 businesses in 28 states and representing all 10 of the HHS regions of the country. 21 of SHRM's 22 industry categories have been covered, so we have representative examples of businesses in all categories except for mining. So I do want to say, if anybody out there has a relationship with a mining industry in your state that has supported their moms, we would love to hear from you so that we can reach all 22 businesses. And out of this rich reservoir of data that we've collected, we will be building the online searchable resource for businesses that will be launched hopefully early in 2013. I also want to mention that part of the process involved going through all of those submissions and selecting 24 businesses that had what we consider to be the most captivating stories to tell. And we paid a site visit with these businesses with a video crew to collect their story. We found interviews with HR managers, with supervisors, with moms, and we did this in 8 different states. So it's been very exciting. We are going to be now creating powerful 2 to 3 minute videos of each one of these 24 businesses to highlight their solutions. So I'd now like to turn this over to Ryan to talk a little bit about what the database is going to be like. Ryan?
Hello, thanks, Kathy. Hello, everyone. It's great to be on this call, and I'm really excited to be able to present a draft of the website. It's been a very exciting journey working with a lot of people all across the country, and it's fun to start seeing it come together. So what we're going to do today is just walk through a few of the screenshots. And again, I want to highlight that this is a draft. It has been shared with the Office of Women's Health and received great feedback, but it hasn't finished going through the clearance process. So what we'll do is just quickly walk you through what the site will work, how it will work, and what it will look like. And as you can see, that this will be embedded within womenshealth.gov, the Office of Women's Health's website. So we had to make sure that everything that we designed really looked to fit seamlessly within their website. On the left-hand side, you can see the navigation panel, which is where they're going to be able to click around and get to different components of the site. What you're looking at right now is Workplace Home. In addition, they'll be going to be able to see by industry. We're doing a concept called Common Solutions, where people can really just get right to the point and find a solution that meets their needs. And then we have other informational pages like frequently asked questions, the business case for breastfeeding, legislation information, policies, links to other websites, and as well as a link that can help them get additional support. So the content of the home page, as you can see, we really highlight that it's solutions for nursing employees with some introductory text. We're still looking to identify the right picture to capture what this project is doing, particularly with the hourly workers. There's a quote here. Below, there's 2 videos, one from the Surgeon General, and then in purple, kind of in the middle, you can see that it says go to industry and go to common solutions. So those are the 2 main areas from which the person can navigate. What we're going to do today is just focus on the industry path, and you'll see common solutions at a later date. So if you, once they, from here, they're going to be able to choose from a drop-down where they can see a list of the 22 SHRM categories, and then once they select it, it will take them to the industry page, their industry page. So here we can show that someone's looking at agriculture, fishing, and hunting. There's, again, brief introductory text. When we really thought about this, we wanted to really highlight the pictures and videos in the multimedia, especially when solutions can be so visual. We wanted to make sure that that's how we communicated the information. So we like to keep the text and introductions nice and short and concise so that more energy and attention would be to the videos. So you can see here the primary picture up front is actually a video, and then they can see a film strip of pictures and videos below where once they click on them, they enlarge. So that's the multimedia section of the page, and then when they scroll down, they're going to see additional information about space, time, and other. So this information is just really high-level bullet point information specific for that industry. And again, you can see we opted for bullet-pointed lists over paragraphs. Then down here, there's a purple button that says Go to More Solutions, and that will take them to the Common Solution section. Or what they can do is see one of the business examples from the database of the 163 solutions that are part of that industry. So now we'll show you what it looks like if they click on Writer Affiliated. Again, you can see the name, you can see the city and state, as well as brief introductory text about that company. Again, we want to highlight the photos. We're choosing a combination of photos that don't just show the solutions, but also really show the women at work, so that they can really see this balance of, yep, a mom will still be working, not necessarily as she's pumping, but this is part of integrating within her day. So here they see pictures, and they'll also see videos when we have them. And then they can scroll down, and when they scroll down, they'll see information, again, divided by workforce, information about the company with their workforce, the space solutions, time solutions, and handling milk. And we went with a very straightforward, bullet-pointed approach again here. And then we really think we've received some very powerful quotes. So we wanted to make sure that we highlighted both quotes of someone representing management as well as an employee themselves. And I just want to reiterate, we collected a lot of tremendous data throughout this process. And it really helped guide what we focused on in terms of what were the most relevant things to highlight, as well as where to prioritize it on the page. And this information really helped us understand the landscape of workplace support across the country, as well as gave us additional information that we'll be incorporating in future phases. So that's the website, and we will be continuing to work on other pages, and we'll be launching this, as Cathy said, early next year.
Thanks so much, Ryan. Well, now what I'd like to do is to take a look at just a few of the creative solutions that we found and heard from the businesses that we visited around the country, as well as the businesses that were described by the coalitions when they entered their data. And one of the first things I want to say is that one of the things we learned is that businesses really do want to support their employees. But for most of them, they just need the solutions. They need to know, how do I make this work? And that's why this whole website is going to be very, very solution-focused. And one of the things we also learned was that of the barriers that businesses face, it seems as though space is the primary barrier. Most businesses felt like the time was an issue that they could very easily work with, but the space was the issue. So I wanted to just kind of walk you through a few examples of some of the businesses that we have heard from. And I do want to just point out that I think most of us as breastfeeding advocates and educators are well familiar with many of the common solutions. We all know about, for instance, single-user rooms and what should be in that single-user room. What should it look like? What kind of amenities need to be in there? We know about converting closets. We know about converting storage rooms. We even know a lot about flexible workspaces. One of the things we got a lot more information on was some of the creative ways people are using partitions. So, for example, here's a picture of a little partitioned off area that the University of South Carolina uses to create space where there was no space. And I think this is one of the keys we need to remember, that many small spaces of the kinds of settings that our hourly workers and moms are working in, an office is just not going to be available, and a closet may not be available. We may need to look at some very creative solutions using screens. This is a screen that someone purchased from a local lumber store. They paid very little money for it, and it seemed to work very well for setting up a lactation space. Here's another more elaborate screen. I guess there's no doubt about what's going on behind that screen, but that was kind of an interesting idea that we found. So there were a lot of great solutions for partitioned areas that could be created within existing space. But we also got some very outside-the-box thinking from a number of businesses, and I know we don't have a lot of time on this webinar, but I do want to just kind of show you a few examples of some of the things that we found. And the first one I want to mention is the Ryder Berry Farm, because this is one of the ones that Ryan showed you earlier in the little images of the website. And you might be wondering, wow, what is that tent and what all is going on in that farm? Obviously, in a farm like this, where your workers all work outdoors and there is no building, there is no place to put a partition. I mean, this is just, you really have to do some outside-the-box thinking. And so what Ryder did as one of their solutions, they do have an outdoor truck that allows women to be able to wash their hands to remain sanitary. So this was a great benefit for the breastfeeding moms because they could wash up and wash their pump parts outdoors. But they actually use a pop-up tent. This is an idea we've talked about for a number of years, but this is the first business we know of that actually put this into practice and have found that it really seems to work very, very well. The nice thing about a pop-up tent like this is that it folds down very easily. The moms at this berry farm in California store their milk in their own personal coolers, so they don't need to have a refrigerator outdoors. And another option that they came up with.
Welcome to GoToWebinar, Web Events Made Easy.
To walk a long distance to the parking lot. Or they can actually, if they don't have their own vehicle, they can use a vehicle that is owned by the company. And this was a partnership with the WIC program where the mothers were able to get these beautiful sun visors to put inside the windshield to not only provide privacy but also to help keep that cool. That was provided by the WIC program in California. So a great example of some wonderful collaboration. Another example of an outdoor setting that I wanted to mention, I know Amelia Smythe is on this call, and she's one of the ones that has worked out this very creative solution, and if there's some questions about that later, maybe we'll have time to allow her to address this. But this was a solution that was arrived at for bus drivers in Oregon, where they purchased brand new porta potties and retrofitted them by removing the potty. And this now serves as a portable lactation station. These are placed in very safe areas around the bus route for moms, so they're not just sitting out on a street corner necessarily, but they put them inside bus refueling stations and other places that would be considered very safe for moms. In the accommodation and food service, I want to mention a couple of great examples of some businesses that are doing some creative things. The Hampton Inn in Indianapolis is certainly a hotel, and the manager there told us, she said, a hotel is a great place for lactation support because there is always space. We used to think that hotels might be some problematic type environments, and we learned that they really can be very easy can have some very easy options. One of those options is to allow the employees to certainly use an empty guest room that isn't used. But they also, one of the nice things about that is that they do have a sink that's available in that room so they can wash their hands and wash their pump parts. They also at this hotel make their conference rooms available whenever they're not in use. And if that's not an option, then they also make the hospitality suite available. And I learned that the hospitality suite is not always used all that much. It's often empty a lot of the time. So that's certainly another option that a hotel could consider. One of the things I really loved about this hotel is that this manager, very community-minded, very proactive, went into her community and she visited other businesses in her neighborhood and told them, if you don't have space for your employees, send them over here to the Hampton Inn because we always have some kind of space available. Please feel free to allow your employees to come over to our facility, and we'll be happy to accommodate them. And I think that is where we need to get as a society, where we are working together and we are reaching out into our community and providing that support and helping one another. One of the other examples I wanted to mention of a business with a very small space is Burgerville in Oregon, another Portland, Oregon business. Very, very small environment. So you can see from this picture there's not going to be a lot of space to choose from. So one of the options that they've come up with, if you see this red door kind of in the middle of the photo, that actually when you go in there opens up into the manager's office. So they allow the manager's office to be used. When using a manager's office, you do need to think about things like surveillance cameras. They have to be covered. And certainly if there are HR files that are stored in there, you'll want to make sure that those are covered and locked up and secure as well. Let's take a little trip over to retail, and I'll show you a couple of examples from retail outlets. One of the ones that we were very intrigued with was a Walmart store. This Walmart is based in Palestine, Texas. And one of the options that they came up with was to take one of the dressing rooms in the general customer dressing room area and retrofit that so that it can serve as a breastfeeding mother's room. So they, put some very basic amenities in there, a place to sit and a lamp, just some candles for a little ambiance. The manager said the most expensive part about this entire process was the electrical outlet that they installed. And he said that wasn't even very expensive. It was quite a bit less than $100. He said it was a very small price to pay to be able to give those moms the support that they're going to need. They also make that particular room available for their customers. So it's not just for the mothers and employees, it's also for customers as well. I want to also mention a really exciting project that's going on in Indianapolis, and this is at a Walgreens store there. And as many of you know, many of the pharmacies around America are really doing a really great job of not only dispensing the medications and things that they sell in the stores, but many of them are becoming very community-minded and trying to look at health initiatives and how can, as a business, they can contribute toward greater health in the community. This particular Walgreens store is among many that now provide on-site health care providers who can dispense immunizations, flu shots, and other types of treatment. And if you look over on the left-hand side of this picture, you'll see a little glass area there. That is a frosted glass, sliding glass door. And if you look behind that sliding glass door, which you cannot see behind, there's a little small area here. This picture makes it look a lot bigger than it actually is. It's actually much, much smaller. But it's where they give the flu shots and immunizations. And this is the space that they are able to use for moms who work there, who need a private space to be able to breastfeed or to pump their milk during the workday. This is a picture of Amy on the right, who is one of the managers of the pharmacy here at this Walgreens, and another picture of a nursing mom who has utilized facilities there. One of the other things about Walgreens that I think has been very, very exciting is that they are piloting a new program that they're calling Weight Check Wednesdays, where they are collaborating with the Indiana Perinatal Network and working also with a local hospital. What they do is they allow a certain period of time on Wednesdays to be open for mothers to bring their infants, who are nursing, to bring their infants in to have them weighed. We know for a lot of mothers that's one of their biggest barriers and concerns is my baby gaining enough weight. So the hospital provides a lactation consultant to be on staff here at the Walgreens during that period of time. This is a service that the hospital provides, and it allows them to meet their requirements of being involved in their community. The mother gets free lactation care, and everyone seems to really value and appreciate that service. I do want to say, don't rush out to your Walgreens store and ask them to start this program, because there's a lot of details that are currently being worked out by Tina Cardarelli and her team at the Indiana Perinatal Network. But I think there's some exciting things that we'll be learning about soon in terms of how we can support moms working in that environment. Finally, I wanted to mention in retail, I think we have time to show one more. This is a company in Vermont called Zutano. Some of you may have seen those clothing line. It's a baby apparel organization. They create and manufacture clothing for infants and toddlers. Their corporate office is located in the middle of nowhere in the mountains of Vermont. This is used to be a barn. They retrofitted this barn, remodeled it, and turned it into their studio. They have their designers working in here, and all the work that creates the magic happens inside of here. They have a couple of options. They are a very, very family-friendly organization, and in addition to providing space, if mothers need private space to breastfeed, they actually make a private office area available for mothers who are breastfeeding to allow them to bring the baby to work. So these mothers get a special office during the time that they're breastfeeding. It's a large office with a door that locks. They can bring their babies to work. While we were there were just very exciting to see infants crawling around, and also to see the other staff that all take ownership and take care of each other's babies, and just really create that kind of warm, family-friendly environment that makes everyone very happy and very satisfied. This is the manager of Zutano. He really believes strongly in having that strong family environment. He even brings his dog to work, so it's a really fun environment to be able to work in. And for those mothers who do not want to bring their baby, or maybe the baby's past a year of age and they are continuing to pump, they make available the studio, the photo studio, where they shoot their models that are modeling the clothes that they're eventually going to put in their catalog. So that's the little space that they make available to their moms. I think I have time to show you maybe one or two more. So I'd like to show you maybe the Middletown High School in Middletown, Connecticut. As we know, with many schools, space is not as big of an issue as time is. So I want to share a little bit about what they have done here at the Middletown School District. And I do want to point out this was a collaboration between the school system, the school district, and the Connecticut Breastfeeding Coalition. It's an amazing collaboration where they work together to provide resources and support and assist the school district in helping all of the schools in their entire system to be breastfeeding friendly. So they have lactation spaces in all of the grade schools, middle schools, the high schools, and their alternative schools within the school district. And I just wanted to read maybe a simple quote that we got from Dr. Patricia Charles, who is the superintendent of the public schools in Middletown. And she made this statement. She said, "It is so hard for young mothers to juggle their careers, their children, and their family responsibilities. We don't want to make anyone feel they have to choose between their career and raising their family." And I think that was such an exciting quote, that this is a true commitment that they have made for their mothers. They provide space in a wide variety of ways throughout the school district. Some teachers use their personal office and use their private planning period to be able to express milk. Some of them use the school clinic that is available within each school. Some of them also use the family living area, where there's a space that they can pump their milk during that space as well. And I wanted to show you this lovely picture of the custodian at the Middletown High School. Her name is Maria. Maria was a huge breastfeeding advocate and decided she was going to take this as her mission to help find some good places for moms to pump. in addition to the school clinic and the teachers' offices and the family living area. So she found a room that is actually the teacher resource room. And you'll see on the left-hand side of this picture there are some curtains that cover some shelves. On this side, what you can see with the chairs, this is the part of the resource center that they have curtained off so that breastfeeding mothers will have a private place to express milk. And on the other side of that curtain are the bookshelves with all of the teacher resources. And they did place a little refrigerator in there for the teachers as well. So it was just a really fun program to be able to visit. They're doing some amazing work there. I also wanted to show you a couple of slides from the McDonough Elementary School there in town, where they had come up with some great solutions to handle time. One of the things that they did as part of their program is they have hired what they call rotating floaters. And these floater staff are substitute teachers who are there just to provide coverage whenever a teacher needs it. So they will provide coverage when a teacher needs to be out or away expressing milk. They will also provide coverage if somebody has a doctor's appointment, or the plumber calls and you need to meet the plumber at the house because you had an accident in the kitchen. Whatever reason that a teacher might need to leave, they make that available for them. They also have a great working relationship with the staff. All the staff are very willing to cover for each other. So they all feel like there's always going to come a time in our lives when we might need help. And so I'm going to cover for you right now during this time because I know there might come a time when I'm going to need that help. One of the things that they discovered was that nearly all of the teachers were providing classroom time for a portion of the hour, but that there was always a little bit of downtime where the students were often involved in more independent study. And it's during this independent study downtime that the teachers will use that time to slip away to express their milk. Another option at this school that worked very well is that the teachers actually let their principal know as soon as they find out that they're pregnant. And that way the principal is able to set a schedule for them way, way, way in advance that will allow them the flexibility to be able to come back to work and express their milk whenever they need to. I wish I could just, take the spirit of camaraderie that was in this whole school system and just bring it to you in some way. It was a very, very powerful place to be, to feel this kind of support that was available for all of their staff. Finally, I want to just tell you about a really cool idea of something we learned at NASA. This is a NASA Goddard Flight Center in Annapolis, Maryland. And one of the things that they do at NASA, they have a huge campus with more than 50 buildings across their campus. And they do have a lactation room in all of the buildings on their huge campus. But one of the things that I love best about this program is that they also designated in each building what they call a super mom. And the role of the super mom is to be a resource for everyone else in that building. So she provides oversight to the room. She's just a volunteer. She's just another mother who actually breastfed her baby and used those services. She checks in on the room from time to time to make sure everything is clean, and if there's any issues, she reports those to the appropriate people. She also seeks out women who are pregnant in that building to let them know that there are going to be some options for them. She'll take them on a tour of the lactation room so they can see what they'll be in for, to hopefully help women solidify that breastfeeding decision much earlier. And certainly after the baby is born, they're available to those mothers as well to provide support and to make referrals. Finally, I want to show you an example of a manufacturing company in northern Georgia. This was an amazing company, Shaw Industries, that employs over 23,000 people in their various plants. And this was their plant at their headquarters in Dalton, Georgia. And the women who work here, obviously, they're on very fixed schedules. It's a lot more difficult for women working in the manufacturing environment. One of the things that they did here, you'll see a fire extinguisher here, and right next to that is the lactation room that they set up. It was just a small office area. One of the first things that they did was cover the window with this sheet of metal something or other that secured that to the door and covered the window so nobody could see through it. And then they have a lovely little lactation room in here. It's very simple. but it provides the basic necessities that moms might need. The supervisors were trained. The school nurse was, not the school, but the occupational health nurse at Shaw was trained. This was all done through a collaboration with the Georgia Breastfeeding Coalition, the Georgia WIC program, and the Georgia Department of Health. And the breast pump you see in this room was provided to this company through a grant from the Georgia Nutrition and Physical Activity Program. So it was a wonderful collaboration. And I have to tell you, the manager at this company was he was blown away by all of the resources in the community. As I mentioned, they trained the nurse, and now the nurse is able to provide support and education to their employees. She can teach them how to use that pump and do the follow-up and make referrals as necessary. So that brings me, I guess, to the closing slides that I wanted to bring us back to remind us about the role of partners. Folks, I don't ever want anyone to forget or underestimate your power as a coalition in the role of partnership. Most of the businesses we have worked with over the course of this project have said they could not have done this without the help from their community resources. So don't be bashful. They need your help, and they truly want your help. In closing, I want to just briefly mention a couple of new resources that are coming. One is a toolkit that is focused on hospitals that will be an online resource available as a download soon after the first of the year, and also a toolkit that is specifically targeting K through 12 schools and colleges and universities. You all also have seen me kind of flipping around through some slides, and these slides are all part of a PowerPoint presentation that has been developed, and it's actually, we call it a PowerPoint platform because it is full of hundreds and hundreds of photos, slides, videos, picture stories, case studies, all kinds of incredible information that will allow you as coalitions to take this resource that will be available as a download and present this, whatever you want to present out of this for your community. It can be presented to the local Chamber of Commerce meeting, it could be presented to a local SHRM meeting, or if you want to do a full day training, this is the information that really comes out of the original business case for breastfeeding curriculum, but it's structured in a PowerPoint presentation that will allow you to have a rich resource to be able to share with your community. I do want to tell you that this particular resource is going to be available probably around February. It's almost completed now. We are planning to do a web-based training program for anybody in the coalitions who would like to be a part of that, and you'll be getting more information about that coming very soon. So we're excited about this. This is different from the website. The website is the online website database that's for the business community. This platform is your PowerPoint. This is your resources that will help you to be able to to do training for local businesses or whatever information you would like to share with them. And finally, I want to mention that the New York Department of Health has been working on a special project that focuses mothers who are working in low-wage jobs, particularly WIC mothers. This is a toolkit that will be ready also around January or maybe February at the latest. It's going to be including online materials for employers, mothers, dads, grandmothers, and child care providers. And this has been a project that's been funded by a grant from the CDC. So it's been a wonderful new project. I've had a great deal of fun working on this with New York. They base this on focus groups and with mothers and in-depth interviews with employers across the state. So folks, as Ursuline said, the time really is now. Not only is our national agenda focused on priorities of worksite support for moms, but now we have some incredible new resources that are all going to be rolling out right around the same time, shortly after the first of the year. I think, really, when you think about it, it's an amazing gift. And I don't think there's ever been a better time for you to get involved. And so I want you to ask yourself and ask your coalition, if not you and your coalition, who else is going to take this on? And if not now, when? So I want to encourage you really to seize the moment and let this be an opportunity to reach out to your community and to your businesses in a really big way. Now would be a great time to start planning for the rollout of these incredible new resources. With that in mind, and on behalf of the team, I want to thank all of you for participating in this and let you know we are very happy to provide whatever resources and information will help you as you begin preparing for some of these new opportunities ahead. Megan, I'm going to turn it over to you for any questions and answers and final announcements.
Fabulous. Thank you, Cathy. Before I dive into the questions, I think we've had several questions for those folks who maybe missed the information at the beginning. Can you just repeat the details about when these resources will be available? And also a second question that came along those lines is whether the pictures will be available, the different pictures, the examples, separately as photos.
These photos are available in the website or in the presentation platform, so they are available for that purpose. We'll have to be providing you with more guidance on how those photos can be used and which ones can be used, etc. But these photos were all contributed to us by the different businesses for this project, so it's going to be an exciting time. The resources, I can't give you an actual launch date because we are not entirely clear on how long it will take for everything to get through the clearance process at HHS, but we're anticipating early in 2013. We hope, within the first couple of months or so, and we'll certainly be getting information out to all of you once these are ready to go, and certainly when the web training is available for you, we'll be making sure you are aware of that as well.
Awesome. Another question is specifically about the military. Where do you see the military in this plan? It clearly is in the category of difficult workplaces, but not necessarily hourly workers.
That's a great question, and definitely the military workers are a huge issue. I don't believe we had any submissions specifically for military, although we know that a number of government military groups such as the Department of Defense do have some wonderful lactation programs in place. If any of you have some experience and would like to submit stories of how women can be supported in those environments, we are all ears. As I mentioned, this public side of the website where people can submit their stories is still open, and if you would like to submit information, we are going to be happy to continue to get that. So, good question.
We have another question about asking about ideas on how coalitions might approach their local SHRM, that's the Society for Human Resource Management, their local affiliates of SHRM, to share these resources.
All right, excellent question. I know a lot of states are already working very closely in collaboration with their state and local SHRM chapters. I will say that SHRM has been one of our strongest partners in this entire project. I have met with them on numerous occasions now, and they are very, very excited about this project. They've made a number of resources already available on their website for their members, including a videotaped interview that they conducted with me to talk about the overall project and how businesses can support their employees. We expect that there will be website links on their website, hopefully, or the information will be made available to their local chapters. But I would suggest if you're living in the state and you would like to contact your local SHRM chapter, go to the state office, let them know who you are, and let them know about the project and see if they would be willing to allow you to either perhaps make a presentation at their state conference or to speak at their chapter meetings. They have chapter meetings every single month, and they're always looking for good speakers. I know many of our coalitions have been very actively involved with SHRM, and they've been just awesome partners.
Wonderful. We have a couple of questions. I'm just going to take a couple more. I know we're running low on time. We have a question about the school examples. Did any of the schools give examples about the students being able to pump while in school?
That's a good question, and I don't know that any of the schools we talked with or that submitted their information also provided that for students. I know that is a big issue in a lot of schools. That's a good question. I'm not aware of any of the ones that are listed in the database that actually open that program up to their students. But frankly, you know, all of these that are providing support for their employees are so tender and sensitive in their realization of what their employees need that I would find it hard to believe that any one of them would not want to provide that support for their students. So it may be that the place to start is with your employees, get a program set up, get everybody, you know, used to it, normalize it, and then reach out and ask how can we now make these services available to students.
Kathy, I would like to say that one of the things that we did when we were in Connecticut is ask the nurse about the school nurse about that. And she was willing to work with students, and I think that that's the place where the students should begin, is with the school nurse.
Yes, thank you, Ursula. That's definitely true.
Great. I'm going to ask just a couple of really quick answers. I'm actually going to defer. We have a number of USBC announcements, some very exciting news for coalitions, but we do have it all very nicely written out. So what I'm going to do with our USBC announcements is actually send it out as an email blast to the coalition. So please watch for that. Lots of good information here, preparing for new initiatives starting up in the next couple of months. And so just the other couple of quick questions before I turn it over to CDC for a couple of announcements. One is there a cost involved in that web training for the coalitions on the platform?
No.
Okay, I figured that was an easy one. And the second quick question is how can coalitions share info with the project? Would that be by contacting the three folks on the screen here?
That would be a good start. Ursula, I don't know if you have any other guidance on that.
I would start with the contacting the names that have been provided.
Okay.
And remember, if you live in the western half of the country, you'll want to contact Doris at Altarum, and if you live in the eastern half of the country, you'll want to contact me at Every Mother. Okay.
Wonderful. Well, thank you again so much, Cathy and Ursuline and Ryan. This was a fabulous presentation. Again, I'm going to defer our USBC announcements to email so that we could have a little more time on questions. But I do want to just turn it over now to our friends at CDC for a couple of announcements.
Hi, everyone. This is Carol McGowan at CDC. I just have a couple of announcements, so this will take us right to the top of the hour. First of all, if you remember, in about 2005, we put out our first CDC guide to breastfeeding interventions. The new and improved, revised, and updated guide is making its way through our final stages of clearance, and we're going to make sure that we let you know as soon as it's available for downloading off of our website, but we're very excited about that. The second announcement I want to make is for those of you who have been involved with the state networking calls that happen monthly, in January and in February, on each of those months, we're going to have 3 of our community-funded states present the initial stages of the work that they've done for support for mothers in the early postpartum period, and this is prevention and public health funds that are paying for this. So 3 states will present on the networking call in January, and 3 will be presenting in February, and then about 9 months from now, we will be asking them to present again to talk about what progress they've made, because we've gotten a lot of questions from the states about what those projects involve. And that's all I have, Megan.
Wonderful. Thank you, Carol. So we will be adjourning the webinar now. Again, if you are one of the 5 folks from your state connecting to the regional call, you will need to disconnect or hang up from this webinar and dial into the regional number that was provided by your state's designated contributors. And then for all folks, please do complete an evaluation. We really do value that feedback from you on these webinars and the regional calls. So you will find that link on the web page, the landing page that I referred to earlier. You'll also get the link directly in an email that you'll receive from the webinar system in just about an hour. So thank you again to everyone for participating today, and we will catch you in the new year. Thanks so much, everyone. Take care.